This is Virginia Kaufman. She's doing a rotation at the Vein Treatment Center and veins.com. She's going to be talking about cellulitis, which is a common problem with or without vein issues. These are infections in the legs that can occur after any type of bites or spontaneously or in diabetics and so on, or from injury and trauma. So go ahead, Virginia Kaufman, Damon College.
Cellulitis is an infection and inflammation of the dermis layer of the skin and the subcutaneous layer as well. Sometimes an abscess may form. There could be some purulent drainage or ulceration occurring. And it usually occurs through a break in the skin, dry irritated skin, insect bites, or after a laceration. It's not a contagious infection. The most common organisms that cause it are Strep pyogenes and Staph aureus. The patients that are at risk are diabetics, patients with peripheral artery disease, cancer, venous stasis, chronic kidney disease, immunodeficient patients, and lymphedema patients. The most common site of cellulitis is the legs. Other sites include the arms, the face, and the periorbital region. And about 11% of orbital cellulitis patients lose their vision. Some signs and symptoms that are seen with cellulitis include fever, lymphadenopathy in the region of the infection, inflammation, pain, tenderness, warmth, and there may be some drainage at the site. Some complications of cellulitis include abscess formation. This is common with MRSA, lymphangitis, gangrenous cellulitis, necrotizing fasciitis. Commonly seen in children, it occurs with meningitis, and septic shock and death are other complications of cellulitis. The workup for cellulitis depends on the severity of the infection. In some patients, you may need to do blood cultures. Most patients respond to antibiotics in an outpatient basis. More than 90% of patients do respond to the antibiotics. If non-responsive to treatment, the patient needs to be admitted with IV antibiotics to further treat them. Warm compresses at the site of the infection help as well, along with keeping the skin clean. And if there's an abscess formation present, that would need to be drained as well.
So the most common organisms that cause cellulitis are MRSA, which stands for methicillin-resistant Staphylococcus aureus, and Staph pyogenes.
Strep pyogenes and Staph aureus.
And these are not basically communicable diseases, but hygiene is important.
Yes.
So in hospital settings, making sure, especially in patients that have abscesses that are drained, to make sure that you wash your hands, you use gloves so that you don't cross-contaminate it to other patients. Correct. And sometimes, and very rarely, this can become systemic infections like Virginia said, and you can get sepsis, which is when the bacteria gets into the bloodstream. It goes to different organs and can cause multiple systems organ failure. Actually today, one of the 3 doctors that got the Nobel Prize, it was announced today, did his research on multiple systems organ failure and death. And I don't know his name, but that's an important thing to know. These things are all very virulent organisms, and they can start an array of things in the body where the body's immune system goes haywire, and then it starts destroying its own tissues. So that's called multiple systems organ failure, which eventually causes kidney failure and death from injury to the lungs, the heart, the kidneys, and so on and so forth. So cellulitis is a very important thing to have. I just wanted to add a couple more things. Lymphangitis is a variation of cellulitis, so that involves the lymphatic system. And as every time patients with lymphedema get infections like cellulitis, it destroys more lymphatic systems and makes their conditions even worse. Thank you, Virginia. This is Virginia Kaufman from Damon College. She's finishing a rotation at the Vein Treatment Center and veins.com. Thank you very much.